Cataract surgery has not been around as long as cataracts are, but it has been around for a really, really long time. And over that history of cataract surgery, it's gotten better and better and better. And so while it's accurate to say we had cataract surgery around in the 40s and we have cataract surgery now, it's also misleading because we had phones around in the 40s and we have phones now. But the idea in the 40s of being able to pull your phone out of your pocket and be able to have access to any information in the world or a really, really high quality camera, that was alien technology. The technology within cataract surgery has evolved over that same period of time in some pretty dramatic ways. And so we're going to go through some of the ways that technology has made cataract surgery much safer and more accurate with a quicker recovery. So first things first, let's talk about safety, because safety matters. So in general, with any procedure that you're doing on the human body, the less you can disturb the surrounding area, the more you can sneak in and sneak out, the more safely the procedure can be done. And that's for a couple of reasons. It causes less inflammation, it's less chance for infection, and all of that makes the recovery a lot faster, and it makes your chances of disturbing anything around it much, much lower. So a long time ago, cataract surgery, and I'm going to try not to get gross on this, so I'll just talk in very vague terms, it involved a much less sneak in, sneak out type of approach. And that was true all the way up until the late 70s and 80s. But a specific piece of technology came along thanks to the work of a genius named Charlie Kelman, and it's called there's an L here, emulsification. That is a big Scrabble score right there. So phacoemulsification was it was a technology that was developed. Actually, he got the idea when he was getting a teeth cleaning. They were using ultrasound, and so then he had the idea of maybe we could use this to break up the lens inside the eye, because cataract surgery just involves removing a cloudy lens and replacing it with a clear one. And so he had the idea to use ultrasound. Now at first it didn't work and everybody thought it was a really bad idea. And to be fair, they were right in the beginning. But the technology got better and better and better to the point now where we can do things really, really minimally invasive. Cataract surgery in modern terms just involves two little, I call them tunnels, and the bigger of the two is 1/10 of an inch. It's very, very tiny, and all of that is possible because of phacoemulsification rather than having to actually manually go in and extract stuff like it was in old times. So the chances of losing vision with cataract surgery are so extraordinarily low now that it's hard to give good statistics on it. If you look at a textbook on what are the chances of infection or things like that, you might say 1 in 5,000 or 1 in 10,000. But I definitely don't see anywhere near that rate, and you can talk to people who have not seen anything like that in 100,000 cases. So any surgical procedure will have inherent risk, and you want to make sure that the benefit outweighs the risk. But when the risk is as low as it is in modern terms with cataract surgery, it means that the benefit can outweigh it pretty easily. So that's the first of those, and that's safety. The second one is the difference in technology. And so technology, I was going to write tech, but that felt lazy. Technology, I was burned by when I tried to write emulsification and forgot my L. Technology is the big difference between where we were and where we are now, and it's in two different categories. One is in the diagnostic category, how good we are at knowing what an eye needs before we ever do a procedure. And the other one is on the actual treatment or therapeutic side of things, how good the technology is at actually fixing the problem without causing a bunch of inflammation and difficulty, which is why recovery is so fast. The third of these, recovery, I'm going to keep referring to it, so I'm going to write it up here. The technology piece that matters so much with recovery, and it's the same reason that things are more safe now than they were, is because of how you can do this without really disturbing everything around it. And I know we keep coming back to that, but that is why cataract surgery today is It's difficult to describe what an easy procedure it is to go through because there's not any other surgical procedure where you actually are replacing something that you can do it in a way that involves nothing. I'm trying to keep it in general terms, nothing gross, like there's no blood. And so when that's the case, it makes things recover really, really fast. There's one other piece of the technology that I want to make sure that I cover, and that is intraoperative laser aberrometry, which I'd write out, but it's more than is necessary to write out. So intraoperative laser aberrometry is using a laser that shines an invisible grid pattern of laser light into the eye during the cataract surgery so that it can tell us exactly what prescription this eye needs for its new lens so that someone will be able to see clearly without a pair of glasses. The reason it's amazing that it's still the part of the surgery that every time I'm like, I cannot believe this exists because it just flat out didn't until recently. The reason it's such a big deal is because every single thing that we do with our diagnostics, which is really good, we measure the eye down to literally 1/100th of a millimeter in every dimension possible. All of it's really good, but all of it is done pre-operatively. We see somebody in clinic, get all of these measurements, and then through math equations, it tells us this is the lens power that we will probably need for this person. Laser aberrometry works on entirely different principles. During the procedure, there's this one moment, not for very long, for less than a minute, but where that eye does not have a lens in it. It doesn't have the old one that's all cloudy, that's gone, good riddance, and it doesn't have the new one yet. And so while you're in that state, what's called being aphakic, without a lens, this invisible grid pattern of laser light shines in, and in 2 seconds, and I mean that literally, a literal 2 seconds, it takes 40 measurements and measures that grid pattern of laser light as it's coming out of the eye. And from that, through some really sophisticated calculations, it tells us this is the lens power that will be necessary. So we can compare that to what all the preoperative calculations were, and it's just made things way more accurate. And it's the part of the procedure, even though most of it is really, really, knock your socks off advanced and would just cause somebody from the 70s to have a seizure if they were to see everything that we can do now. That's the part to me that still feels like Star Trek because it's so neat and so accurate, and it doesn't involve you having to do anything as the patient. It's just a regular part of the procedure. Recovery is the final piece that's different now, and part of what happens with recovery is that we don't have to deal with the body trying to heal a bunch of the tissue that is around it. So when somebody recovers from, say, a hip replacement, they have all of this thing that wasn't hip that has to recover. And even the hip itself, there's new blood vessels that have to grow. To put it mildly, your body's angry for a couple of days. And so you take all these different medicines to try to get everything to heal as quickly as possible. But it's a challenging recovery. Worth it because you can walk again, but challenging. With this procedure, because we're not really damaging surrounding stuff, the place where we make this little tunnel, this little 1/10 of an inch tunnel, it's all sealed over, usually within the first 4 hours, sometimes the first 6, but it's quick. And so that makes the recovery really, really fast. And most of the time when we're talking to people during their one-day post-op, the question is about, when can I go jogging again? And as long as everything looks good, the answer is later that day is fine. So the recovery now has come a long way from where it was back when people used to have to lay on their back and have sandbags on either side of their head. It is a quick, truly, truly outpatient procedure in that most people are enjoying their evening the same day, having dinner with some friends. Technology has helped a lot, and all of those things together have made it a lot easier now to do this than it was at any other point in history.